Welcome to the show. On today's episode, we're going to be talking about science. We are going to be talking about reconstructive surgery. It's the surgery that will make you, it's fixing problems that are there or that are existing or that are not existing. So the doctor is here to tell us all about it. On the show today, we have Dr. Tjinjeka from the Tjinjeka plastic surgeon. I don't know if I butchered your name, doctor. You'll correct me.
No, you're not far at all. You almost said it right.
Yes.
Dr. Tjinjeka.
Tjinjeka.
Yeah, of Tjinjeka Plastic Surgery. So you probably said it right.
Okay.
Yeah.
So obviously you want to know what Tjinjeka means. Or you don't, or it's just a name that doesn't have a meaning.
Yeah, no, it doesn't have
It's one of those names.
I have to find out from my parents if they know.
Okay, let's just have a background of who you are. Just tell us who you are.
Okay, so I'm Dr. Tjinjeka. I am a plastic and reconstructive surgeon.
Okay.
Ke Botswana, ke tswa Maung.
Okay.
Born and brought up in Maung. And so I did everything in Maung until university. I went to University of Botswana for 2 years. I did BSc there, 1.5 years.
Okay.
Then I went to South Africa at University of Free State to do medicine, my undergraduate.
Yes.
Came back, I worked as a medical officer in Francistown. And then I went back to Wits to do plastic and reconstructive surgery.
Okay.
And I came back immediately upon completion in 2020. I started as a consultant plastic surgeon in Marina.
Okay. Let's just stop there for a bit. Okay. So you've always, obviously at school, that's when you choose. You always wanted to be a plastic surgeon or something that came later on?
Not really. Yeah. I have always wanted to be a heart surgeon, like a cardiothoracic surgeon.
What is that?
It's a it's a heart surgeon. It's a doctor that operates on the heart and
like
the chest.
Both
heart transplant, or repair heart vessels, blocked heart vessels, and do lung surgery in patients with lung cancers. Yeah, so basically that's it. That was my initial dream.
Yeah.
And then I ended up in plastic surgery.
How did you end up there?
After finishing, I came back, did my medical officer time in Nyangagwe. At that time.
Oh, so you are doing the general one?
Yes.
And then after that, you go and specialize?
Yes. Oh, so you do general, like basic undergraduate and BCHB.
Yes.
And then you become a general practitioner.
General practitioner, yeah.
Yes. And then after being a general practitioner, then you have to choose. You choose, depending on your interest,
Yes.
Whether you want to do surgery, you want to do medicine, you want to do pathology.
Yeah.
There's a lot of specialties that.
So you are at Nyangagwe, then you decided, no, let me do plastic surgery.
Plastic surgery, yeah.
So
while at Nyangagwe, I thought, heart surgery needed a lot of setup. In our setting, you need a big team to do cardiothoracic surgery or do cardiac surgery.
Imagine.
Because everyone, it's a highly specialized specialty. You need perfusionists, you need every nurse has to be specialized. Every person.
I'll pretend like I know
in
what
that
a perfusionist is.
Yeah, so then I'm like, and then also the lifestyle of a cardiothoracic surgeon. And they work like long hours. They're always in the hospital. And so then I thought, what else can I do?
Do we have those in Botswana?
Yes, we have cardiothoracic surgeons.
And do we have that capability of having such a heart transplant?
Not heart transplant, because heart transplant is really a very small portion.
Oh, okay.
I think majority of the heart surgeons, they don't do heart transplant. Okay. It's only in certain centers
where they do. It's not big.
Yeah. So where they do heart transplant, and it's not something that it's done like routinely as opposed to other things that they do. Cardiac surgeons do. Okay, but anyway, I'm not a cardiac surgeon, so
you decided otherwise.
So I decided otherwise. I decided on doing plastic surgery because at that time there was no plastic surgery in the country.
Yeah.
There was a big need of plastic surgery.
And social media was hyping it up. Is it
Social media was hyping it up, but plastic surgery is not what it's perceived, or what's hyped on social media, because they hype things like cosmetic surgery, things like rhinoplasties, nose jobs, butt lifts, BBLs, but majority of plastic surgery is actually reconstruction. So if we were to put it on a scale, 85%, depending on where you are, up to 90% of the work in plastic surgery is actually reconstructive.
So this reconstructive, we're talking about people who have both third-degree burns. Like, what can you say about that?
So reconstruction is from head to toe.
Yeah.
So you see, plastic surgery is one specialty that is not confined to any cavity. So we address problems from head to toe.
Okay.
So we replace whatever that is lost to restore form and function. So depending on what you have lost from your head to the toe, like basically,
what do people lose?
It could be from you can lose your skin or your scalp skin from your head from a car accident. You can lose your eye from cancer, or you can lose your nose from trauma. You can lose your lip from cancer, your tongue from cancer.
So you can replace the tongue.
So we can make something that function as a tongue, or almost that is closer to a tongue. But obviously you can't.
So is this why they are saying plastic? Because it's not.
So plastics. Real. So again, plastic comes from plastico. So it's a Greek word that means molding. So so we mold things. You take something, you mold it into something that looks like whatever part that you want to reconstruct. So then we mold it. You take a piece of tissue from wherever, it can be from your piece of skin in your around your arm, your arm, and then you mold it into something that looks like a tongue. If you are reconstructing a tongue. And yes.
So if someone lost a tongue, usually it's from an accident.
From cancer.
Most is
most
cancer.
Commonly, yeah.
So you take a part of the skin from.
So you borrow. So we in plastic surgery, there's a lot of things. We're just going to throw in things.
Okay.
So in plastic surgery, we take advantage of the redundancy in the body.
Yes.
So we then borrow we take a part that is not really that functional, or you don't need it, like more to replace something that you need.
That is needed.
That is really needed.
So the decision, it's purely yours as a doctor. You can't say to the patient that we saw some part of your body. Can we take that part?
So usually, these are well defined. It's a discipline. So we know for example, for tongue reconstruction or nasal reconstruction, there are principles that we use.
Okay.
And you have to take something that is possible for you to mold to that whatever thing that you want to reconstruct. So we know that for tongue reconstruction, for example, you can use tissues from your forearm, which is we call then it's a flap. So radial forearm flap to mold something that looks like a tongue, or that functions as a tongue. Or we can take tissues from your thigh, anterolateral thigh flap, and then we mold it again from plastico. We mold it to build something that looks like a tongue.
Okay.
Yeah.
So that's I would say that's the medical part of it.
That's the medical part of it. And that goes from head to toe. Breast reconstruction, if you lose your breast from breast cancer, or like kids who are born with congenital absence of the breast, then we also reconstruct.
You can be born without breast.
There's what is called Poland syndrome, where a part of your side of your chest is it's underdeveloped. That includes anything that can be from the arm, on that side, like your chest muscles, and the breast.
And
the
then
ribs.
how's that different from the plastic one? What do you call it?
Silicone.
The silicone.
So depending on what you are reconstructing. For example, we use silicone a lot in breast.
Yes.
But plastic doesn't come from the fact that we use silicone, which is plastic. It comes from plastic. But
I
we
thought
use
it was that.
No, I know it's very common, you know.
Yeah.
So I get that a lot after, patient comes to me with a problem. We address it with a flap. We take a flap from somewhere or while we are explaining what we're going to do, then they'll be like, but I thought they told me I'm coming to get plastic, Yeah, so it doesn't, plastic doesn't come from, we sometimes, in a very small portion of our reconstructive armamentarium, we have silicone.
Okay.
But often we use patients' own tissues for a lot of reasons.
So we have covered the medical one. Let's go into the
cosmetic, the exciting one.
The exciting one, the cosmetic one. I just want to know what type of cosmetics you offer or you do.
So, well, it depends. I mean, here in Botswana, the most common things is body contouring. Body contouring procedures,
yes.
So liposuction, fat transfer, tummy tucks and liposuction, breast lift, breast reduction. Though reduction is not cosmetic, it's a functional procedure because patients present with symptoms, which maybe we'll talk about. And then what else?
BBL.
BBLs.
You do BBL?
Yeah, to a certain extent we do BBLs.
BBL is Brazilian
butt lift.
Butt lift, okay.
Yeah,
so I don't know if let's just touch on the ones that I would say they are popular.
The popular ones is tummy tuck and liposuction.
So why would someone come to you and say, I want a tummy tuck? What would have happened?
So usually they will present with an undesirable anterior abdominal wall. They will have excess skin, hanging skin.
When you say anterior abdominal, like, for someone who don't know, it's your tummy.
Yes, your tummy.
Yes.
They've got issues with their tummy. Either they have excess skin, like they've got the skin that bulges, that shows in their clothes, and it makes them uncomfortable. And then also fat deposits.
Yes.
After, usually they will start with non-operative measures like exercise and diet, but, the fat does not respond to that.
It's so stubborn, that
yes,
fat.
Stubborn fat, especially around your flanks. And then, just abdominal wall weakness or a bulge, especially with multiple pregnancies, that weakens your anterior abdominal wall muscles.
Okay, I didn't know that.
Giving a bulge that also pushes and shows in your clothes. So those are the three major things that a patient requiring a tummy tuck will present with.
That one, the one with multiple pregnancies, is that the one that people always say it's a mommy makeover?
Yes, so then it's a mommy makeover is actually a group of procedures that are done to restore
the breast, obviously,
including the breast. It can be a lot of it's a combination of procedures. Usually it's a mommy makeover because, like with multiple pregnancies, your body loses its youthfulness, your youthful appearance. Because of your multiple pregnancies and weight loss changes and breastfeeding, your breast sags and they become deflated. And then you have got those anterior abdominal wall or tummy abnormalities that we have spoken about with tummy tucks. So then someone will present with that, and now they want to restore. They've completed their family. Now they want to go back to that.
I was going to ask you that, doctor. Like when someone comes to you and say, I want a tummy tuck, you obviously go through what we call... what's that? You go through the patient and say, do you have a baby? Are you done making baby? So you can't have a tummy tuck.
There's a consultation. You go through a consultation. We look at a lot of things. We look at whether you are a candidate. Your candidate means it can be, like what you want. Is it achievable in my hands? Is it something that I can achieve? And then realistic expectations. And then is it advisable to do that? So realistic expectations, it's someone maybe with something and, when you look at what they have and what they want, you are not able to achieve that. Or you can see that this is a patient that has got a lot of other issues because, with cosmetic surgery,
Yeah.
there's other associated, sometimes there will be an element of some psychiatric issues that you need to iron
Like
out.
body dysmorphia.
Body dysmorphia
Yeah.
that you need to iron out. Okay. Sorry. That you need to iron out and so that you make sure that whatever that patient is asking, it's really what is there.
Okay.
Yeah.
Okay.
And it's something that you can do about.
So what would you are saying, you obviously with a tummy tuck, you have to have completed your baby making
Yes.
procedure.
Because like we are restoring you from the effects of multiple pregnancies. So it's a restorative surgery. So then you should have completed your
But
child.
what if someone is doesn't have babies and they just have a big tummy and they want a tummy tuck?
If they don't have babies and they want a tummy tuck, it depends. Do you want to have kids in the future or not?
That will
Yes, because
hinder
then
you in the future.
it doesn't hinder, it doesn't stop you from
being pregnant.
or having babies, but then it's a futile exercise because you're going to reverse the changes that we're making for you. So, and cosmetic procedures, they are not covered by medical aid.
Yeah.
So that's your money. So, and also what then becomes a futile exercise because you're going to go back there from where you come from. So that is why we advise that you should have completed your family.
So there's misconception, like when you completed the tummy tuck, people think automatically you're going to have a flat tummy. Is that possible, or do you have to do some work after that,
So that's the aim of a tummy tuck, is to give you
a flat tummy.
Flat tummy, if you want to call it that way. So it's to improve your anterior abdominal appearance. That involves, like a flat tummy.
Yeah.
Yes. So the effects should be that, but then you have to maintain it.
Yeah, that's what I was saying. Yes. Like the maintenance.
So
part.
you have to maintain. So cosmetic surgery, the way I see cosmetic surgery, it's usually you do it towards the end of a lifestyle change.
Oh.
So you have changed. That's how I want to approach it, even with my clients. So you have started a lifestyle that you want to adopt, and so usually it will be like exercise and diet, taking care of what you eat and all that. You lose weight, and then so after you have lost weight, you have this excessive skin, or there is some areas in your body, especially around the flanks, resistant fat that you now want to address. So it's a continuum, and then after that, after you have gone through your tummy tuck, you still have to maintain a certain lifestyle.
So Kija, what am I eating healthy still?
Yes.
Am I exercising?
Yes. So you still have to continue.
So what happens if I don't do that? Then I go back.
Then you gain your weight.
Hey.
And you lose your flat tummy.
I think maybe those are the misconceptions. People think that when you have done that tummy tuck, you are done.
No.
You can never get a tummy back.
No.
You continue eating whatever you want to eat, and then you still have that tummy.
No. Unfortunately not. You have to maintain the results. You have to maintain by, adhering to a healthy lifestyle that includes exercise and, diet.
So to close on the tummy tuck, you are saying that the ideal candidate will be someone who's done with the baby making.
With the baby making. And then also tummy tucks or liposuction, they're not weight loss modalities. So if you come because you see the tummy tuck addresses things outside your tummy, It doesn't go inside the tummy to address issues there. This is what is called intra-abdominal fat. If you've got lots of fat around your viscera, around your bowel, your organs like liver and all that cannot be addressed by tummy tuck and liposuction. So that's where now you have to do your diet and exercise, or even up to bariatric surgery,
Yeah.
where you undergo surgery to a weight loss surgery, yeah, which is different. It's completely, I know people confuse that with plastic surgery. Plastic surgery is not. Bariatric surgery or weight loss surgery is completely different from
we were talking
plastic
about.
surgery.
Yeah, what's the weight loss thing? What do you call it?
It's bariatric surgery.
Where I want you to say it's the gastric.
A gastric sleeve.
Gastric sleeve.
Gastric sleeve. There's a lot of procedures that you can do to increase your food intake.
Okay.
One is a gastric sleeve. Like I said, I'm not an expert in that area. It's a gastric sleeve or a bypass. You know,
it's different from the tummy tuck.
It's different from a tummy tuck.
Okay.
Those are procedures that are aimed to lose weight. Once you have lost your weight, then you have your excess skin, you know. Now that's where a plastic surgeon comes. So they are related.
Okay.
So we come at the end of the journey where now you have lost weight, you have reached your target.
Now you have excess skin.
Now you have your you are deflated, you are sort of deflated. So then that's where we come in and remove the excess skin and contour.
Okay, that's where you're saying contour.
Yes.
So just to move on, another procedure that you would say is the one that's popular, but I want us to talk about the Brazilian butt lift. Let's just, what is it about? Is it, I hear that it's depositing of oil fats from somewhere to your butt. Is that true?
So Brazilian butt lift is actually liposuction and fat transfer to your buttocks.
Okay.
Yeah. So we take fat from the areas where you don't want it to areas where you want it, like your bums in this case, in the Brazilian form, in case of Brazilian butt lift. As plastic surgeons, we transfer fat from one area of the body to another.
Okay.
It could be if you want to augment your breast, we can do that. If you want
augment is reducing.
Augmentation. Augmentation is increasing.
Oh, increasing.
If you want a butt augmentation with fat, which is called Brazilian butt lift, we can do that.
We can do that.
If you want your biceps or triceps, arm muscles, or
guys do that.
Guys do that.
Okay, so with the Brazilian butt lift, what is? We thought there was silicone. Is there any silicone that's added there?
So there are two ways of enlarging your buttocks. One is with silicone, and then one is with fat.
Yes.
So Brazilian butt lift is with fat transfer.
It's not silicone.
It's not silicone. You can get gluteal augmentation or butt augmentation with silicone. That is not called Brazilian butt lift.
So what you offer is the Brazilian butt one?
Yes.
The Brazilian butt lift. That one, what is the ideal candidate?
So usually that one does not have a criteria as such. Obviously, you have to be fit for the operation. You have to be the right candidate in terms of your physiology. There shouldn't be anything that precludes you from undergoing a major procedure like that one. But all in all, it has got minimal restrictions.
Okay, minimal restrictions. So with the Brazilian butt, how long does it take for someone to heal? Because I only see people after that they struggle, and I'll be like, was it even worth it?
It takes about, if everything goes well, the downtime is about 3 weeks.
3 weeks?
Yeah.
Oh, that's not bad.
Yeah, it's not bad.
So are you sitting down?
Because it's a procedure that it doesn't involve cutting.
Oh,
you want
it's just injection.
It's just injections, fat injections. So the first 2 weeks, we don't advise that you sit for a long time.
The first 2 weeks?
The first 2 weeks, first 2 to 3 weeks.
Sit for a long time or sit at all?
No, you can sit.
Okay.
You can sit. I mean, like, you have to sit. If you go to the bathroom, you have to sit.
I was going to ask you, are you allowed to even go to the bathroom?
No, you can sit, you can go to the bathroom, but we advise that because now it's a graft, it's a fat. It's like you are growing something, so you don't want to put a lot of pressure on the bum. Otherwise, you strangulate or impair the blood supply because you need blood for the fat to grow.
So this things of them saying people are not going to the bathroom is a lie.
No,
So with the Brazilian butt lift, I've realized that when someone does it, I've seen people who went through the surgery. Usually they come. I don't want to use the word fat, but it's like, I don't know. Is it contouring where you want to match their arms to now this big butt that we didn't know about? Because they don't only have the butt, they also have the hips.
Yeah.
So do you inject everywhere, like the hips, the butt, and also the hands?
No, not if it's just a Brazilian butt lift. Usually, it's just limited to the buttocks.
Yeah.
So, depending on what you want, see, plastic surgery is very unique because a patient will come to you and ask that, you do something, and, usually you can decide what you want.
Yeah.
Where do you want your fat and what size do you want?
Yeah.
Do you want the fat at the buttocks only, or you also want some fat to the hips? And
That will be contouring, that one.
It will still be everything is both is contouring.
Yeah. So the contour. Okay. The Brazilian butt lift. Are we done with it, or is there anything you want to add on it?
I think we are done with it, unless if there's anything.
Is it popular in Botswana?
It's very popular. It's very popular, though. Like a lot of people, they've been doing it outside the country.
Yeah, they don't know that it's
because now they don't know that service is available in the country. So, but yeah, we offer it. It's one very popular procedure now.
So is there a way you can just say, in your opinion, and say no, when someone comes to you, a Brazilian butt lift, you can say no, you're not an ideal candidate, you already have a butt?
No, obviously you can't say no, because the only place where you will say no is when the patient does not have fat.
Yeah.
Because you get those patients who don't have fat in their body. So those are the candidates. Those are candidates for implant, or where we use silicone for.
So you can't come with your mother who
augmentation.
measures you and you deposit fat from my mother.
Asked me, no, that's not possible.
It's not possible.
Yes. You can't take fat from your boyfriend and put it in your bums.
So
there will be rejection.
The fat is not matching.
Yes.
Or
yes.
does it match?
It won't match because it's foreign to your body.
Oh, okay.
So there will be rejection.
Okay.
Just like you can't take anyone's kidney and put on.
But that's not fair, because people who want the Brazilian butt lift usually don't have the fat.
That's actually not, People
Really?
who want Brazilian butt lift, majority of the patients who want Brazilian butt lift, they usually have fat. It's just that the fat, it's
not going to the bums.
It's not going to the bums.
Okay.
It's not where they want it to be.
Oh, okay,
Yeah.
I get you.
Yeah.
But someone can just come as like a slender and say, I want to change my body. Will that be contouring now? Or contouring is when you're fixing someone who doesn't have
Contouring
figure.
really, it's just a general term that means it's just shaping.
Yeah, shape. That's what I wanted
it's
to
just,
say.
It's
Shaping.
just shaping. So if someone comes with, asking for something, like a slim person who wants a Brazilian butt lift, then they are not candidates because they don't have enough fat.
Yeah, they don't
to make a sizable or a reasonable size butt.
Yeah.
So in that case, then the option will be an implant.
Which is the silicone.
Which is silicone. Yeah.
How dangerous is the silicone? Are we hear people saying it can leak, or that's just common things?
So silicone is an innate, sort of an innate substance.
Yeah.
It doesn't cause significant tissue reactions.
Yeah.
I mean, that is life-threatening.
Yeah.
So it's not dangerous as on its own. So you can have a rupture in your body.
Oh.
And then, maybe you will get an inflammation, but it's not. You don't get anything that is life-threatening, unless if you overstay and you get infections and all that. But from the silicone itself, it's a safe thing to do. That's why we use it.
Okay, let's move to the breasts then.
So breast,
it's still cosmetic.
so it depends.
Yeah.
So if
No, we're talking about the cosmetic one.
Cosmetic,
Yeah.
cosmetic breast. Okay.
Yeah.
So cosmetic breast options, or what we commonly do, is a breast lift.
Mm-hmm.
You know, like the same changes that occurs with a tummy tuck, with multiple
Pregnancy,
pregnancies
yeah.
or weight changes. It's the
Yeah, for
breast.
people who have been breastfeeding.
Who have been breastfeeding,
Yeah.
you get sagging of the breast,
Mm-hmm.
and then so now you get a breast lift where we lift by excising the skin and a bit of breast reduction,
Mm-hmm.
and then we give it that youthful appearance again.
Okay.
Yeah.
So that someone can just come out, they want a breast done, and you can say, no, you are not a candidate. What would be not being a candidate look like?
Well, for a breast, depending on what you want, is it a breast reduction? Is it a breast lift?
Yeah.
You know, usually, you know, you are not a candidate is, you know, like maybe if there's anything that precludes you, like anything, if you have got anything that might be life-threatening,
Yeah.
you know, a condition that will be risky for
Yeah,
you to
like,
be put
yeah.
under the knife.
Okay.
So then that's when we'll say you are not a candidate. Or if you are morbidly obese,
Oh.
obesity, high BMI, you know, like we'll advise you to
Lose
maybe
weight
lose
first.
weight first because of the complications that are associated with.
Okay. And then also with the lift, what are you adding? Are you adding also the fat, or you are just adding the silicone?
So with the lift, we're just using the patient's own tissues.
Okay.
You can get just a breast lift or a breast lift with an augmentation where we lift, excise the skin. But if the patient desires some volume that they don't have, that we can't make with the existing breast tissue, then we add an implant to add volume.
Are you also advising, because someone can say I want, and they choose the biggest implant? Are you able to say no, this one is too big for you?
Well, it depends. It depends. I think it depends on from surgeon to surgeon, and then the culture. Certain cultures, you know, like, or they prefer big breast with big implants. But you know, the bigger the implant, the more complications you get.
Yeah.
Yeah. So then we'll advise the patient that
Okay.
you know we can give you the implant.
Yeah.
But then there will be complications.
Okay.
Yeah.
Let's talk about those complications. Now we are done about the different types of plastic surgery that you need. Let's just talk about the complications of the whole plastic surgery thing.
Okay.
Yeah.
So complications depends on the procedure that you undergoing, and then also you get minor complications and then major complications.
Yeah.
So depending on the procedure, for example, tummy tuck.
Yeah.
You know, like tummy tuck with liposuction, you get complications from the liposuction itself, and then complications from just the tummy tuck. Because with tummy tuck, we're cutting and removing excess skin. You can have wound breakdown. You can get wound infections and wound breakdown. And then you can bleed and develop some, you know, hematomas. And then late complications will be like, you know, your scars. There are people who scar badly.
Yeah.
And then complications like from liposuction, you can get what we call contour deformities, where, you know, like you overcorrection or undercorrection. And then you can also get skin infections and bruises and all that. So those are like, you know, like complications that often happen.
Yeah.
Or that they can happen, but they are not life-threatening.
Okay.
Life-threatening complications could be like, you know, like your blood clotting in your legs and then go into your lungs.
Yeah.
You know, like, but, you know, the reason why, you know, you will notice that we've been saying whether you are a right candidate.
Yeah.
You know, because cosmetic surgery,
those things,
yes, we have to check those things and minimize the risk. Because, you know, the nice thing about cosmetic surgery is it's not an emergency.
Yeah.
So if you come and we think that we've got some risk factors that we can modify, we modify the risk factors. And once we've modified the risk factors and we think that, you know, you are okay now, then we can undergo and do surgery. For example, the risk factors could be if your BMI is high or you are obese, we ask you to lose weight. If you are on oral contraceptives, that might put you at risk for blood clots, we stop those things. If you are on any medication that will make you bleed during the operation, we make sure that we stop and wait until the effects have worn out of your body before we can do the procedure.
There are people who come to you from being done by other doctors,
Yes.
and they're just coming to correct, or maybe they're saying, I've done this procedure and I'm not happy about it. Do you have those patients also?
Yeah, no, we have patients. We do redo tummy tucks. Maybe they are not happy, or now they have gained weight again. Now they want to go back to where they were before with the initial procedures.
Or when they've done a BBL and then they come back again.
Yes,
Yeah.
BBLs are known for, like you need multiple procedures for someone to really get what they want.
Oh, okay.
Yes, because fat take is unpredictable. But yeah, we do revision procedures if they are not happy with what they got.
I forgot about the lips. Do you do that one? The lip.
There's lip augmentation. It's not very common, as you see. Most of our people here have got big Africans. We have big lips,
it's not common.
So because what augmentation is just adding volumes to their lips.
And the one for guys, for muscles, is that common?
It's high definition liposuction. It's not very common here in Botswana.
Yeah.
But it's a wave. It's coming.
Yeah.
It's very popular elsewhere in Colombia, Brazil.
So they
South America.
Yes. And what do you put there? You put
It's
also fat.
Yeah, we put fat.
So it's
make 6 packs with fat.
Yeah.
Like Tjinjeka fat.
So in closing, doctor, what do you want to say, and where can people find you, and how can they access your services?
Like cosmetic surgery, it's booming in Botswana.
Yes.
It's life changing. I like it every day when you have seen someone from where they come from.
Yeah.
Like maybe with big breast or with a big tummy, they can't wear the clothes that they will desire to wear. The confidence that comes with cosmetic surgery, it's quite amazing. And so we are open. We are at GPH and Sidilega.
Okay.
And we are also on social media at Tjinjeka Plastic Surgery on Facebook or Dr. Tjinjeka. We share a lot of information. If you go into our page, you can read a lot about different procedures that we offer and prerequisites and all that. If you have a question, you can drop us a WhatsApp. We have a WhatsApp number, which is also on our Facebook page and Instagram. Yeah, so we are available and open to any questions and any discussion.
Okay. But I know
what we don't do though is to give quotations before consultations because it's quite very common. They will ask how much is it. Cosmetic surgery or plastic surgery, it's medicine. So it's not like you are selling chips where you can come and get whatever you want. Like from the discussions, we need to sit down with you and see and ascertain whether what you want is attainable. Are you the right candidate? And then what can we offer what you are looking for? And a tummy tuck for you and a tummy tuck for another person
is different.
It's different.
Okay.
So time differs and a lot of things differ. Okay. So this is why it's impossible to give a quotation over the phone. Okay.
Yeah. So I know I said in closing, but I forgot something.
Yes.
Why do you think people shy away from cosmetic? Like some people, it's like they don't want people to know they went through, and people look down on them like they did a plastic surgery or something. Why do you think it's like that?
I don't know. I think it's, they want it private, but I don't think that it's stigma because there used to be stigma against plastic surgery. These days now people are open about it. They talk about it, but I think they prefer to keep it private.
Why do you think there was a stigma? Or maybe people wanted to say, I achieved this on my own, I didn't get help.
So the stigma is like, culture, like cultural issues.
Yeah.
How can you change what God has given you?
Yeah.
Like this is what God has given you that knows. Why would you change it and all that?
Yeah.
So it was. I think the stigma was from the cultural point.
It's like
view.
You are messing with what God has given
you. So that's the stigma. But yeah, so some people, I think they want to say they have done it, naturally.
Yeah.
But I think people just want to keep it private.
Yeah.
I mean, my patients I've had, you can see, I mean, we share posts
Yeah,
before and after.
Yeah.
They would allow me to do that.
Okay.
And some will give reviews, but they will still be private because I think it's a private thing. Yeah, so I don't know. I don't know, but I don't think it's stigma.
Okay. All right. Thank you, doctor, for coming to our show.
Thank you very much, Seleto.
Peleto.
Thank you very much, Peleto.
Oh, I didn't introduce myself. Okay, there you have it, guys. It's Dr. Tjinjeka from the Tjinjeka Plastic Surgery.
Yeah.
If you want his services, I'll leave his details on the description. And don't forget, guys, we are coming from the Content Center. If you want to use the services, if you want to record a podcast, you can go to their pages. It's the Content Center, and I'll also leave their details too. And it's the Point Blank Podcast with Belezo, and I'll see you again.